This is a summary of the CPIC guideline for serotonin reuptake inhibitors and variation in the genes CYP2D6, CYP2C19, CYP2B6, HTR2A, and SLC6A4. This video will specifically discuss the recommendations for venlafaxine. Videos covering the recommendations for citalopram, escitalopram, fluvoxamine, paroxetine, sertraline, and vortioxetine can be found on the PharmGKB website and on the PharmGKB YouTube channel. This guideline was last updated in July 2023. Patients who are CYP2D6 poor metabolizers may have an increased probability of side effects. The guideline therefore recommends that an alternative antidepressant be selected for these patients. The guideline gives no recommendations for patients who are CYP2D6 ultra-rapid or intermediate metabolizers. This is the PharmGKB venlafaxine pathway. A link to the pathway is provided in the description below this video. Venlafaxine is inactivated by metabolism by CYP2D6. In CYP2D6 poor metabolizers, the metabolism of venlafaxine is reduced. This increases plasma concentrations of venlafaxine. There are over 170 different CYP2D6 alleles which are designated as star alleles. Each star allele can be assigned an activity value based on its activity level compared to the star 1 allele. The star 1 allele has an activity value of 1. This table gives the activity values of some CYP2D6 star alleles. It is based on the CYP2D6 allele functionality table, which can be found on the PharmGKB and CPIC websites. Links are given in the description below this video. It is strongly recommended that you consult the full allele functionality table, as it gives further examples of alleles with their activity values. In addition, the supplementary material for the guideline provides more information on interpreting CYP2D6 genetic test results, as well as limitations and caveats that should be considered. Be aware that some CYP2D6 alleles have an unknown functional status and should be interpreted with caution on a genetic test. In addition, an important caveat for all genotyping tests is that any alleles which are not detected in the assay are designated as star 1. This can include rare increased function, decreased function, and no function alleles which are not routinely screened for in some genotyping tests. It is also important to note that patients can carry multiple copies of CYP2D6. Reports in the scientific literature have described cases where up to 13 copies of CYP2D6 were present in a patient's genome. Alleles which are present in multiple copies are shown using an X, then the number of copies of that allele that are present in the genome. For example, a patient with the genotype star 2x3 star 4 has 3 copies of the star 2 allele and 1 copy of the star 4 allele. The activity value of alleles that are present in multiple copies is calculated by multiplying the activity value for the allele by the number of copies present. In this case, the activity value of star 2x3 is 1 multiplied by 3, which equals 3. Further information about CYP2D6 alleles can be found at the PharmVar website at www.pharmvar.org. A link to PharmVar is also given in the description below this video. The activity values of a patient's CYP2D6 alleles can be added together to give a total CYP2D6 activity score for the patient. The CYP2D6 activity score is then used to assign a CYP2D6 metabolizer phenotype to the patient. Note that genetic tests from different laboratories may not use this scheme to assign CYP2D6 metabolizer phenotypes. Because of this, the guideline advises that a patient's CYP2D6 diplotype is noted and activity score calculated before making clinical decisions based on this guideline. These are the CPIC recommendations for venlafaxine. There is no recommendation for patients with a CYP2D6 ultra-rapid metabolizer phenotype. This is due to insufficient evidence showing a clinical impact of increased venlafaxine metabolism. Patients with a CYP2D6 normal metabolizer phenotype will have normal metabolism of venlafaxine. These patients can begin venlafaxine therapy with the recommended starting dose. This is a strong recommendation. There is no recommendation for patients with a CYP2D6 intermediate metabolizer phenotype. This is due to insufficient evidence showing a clinical impact of decreased venlafaxine metabolism. Patients with a CYP2D6 poor metabolizer phenotype will have decreased metabolism of venlafaxine compared to normal metabolizers, and the poor metabolizer phenotype has been associated with adverse effects. A clinically appropriate alternative antidepressant which is not predominantly metabolized by CYP2D6 should be considered. This is an optional recommendation. Drug-drug interactions and other patient characteristics should be considered when adjusting dose or selecting an alternative therapy. There is no recommendation for patients with a CYP2D6 indeterminate phenotype. The recommendations for venlafaxine can be found in Table 2 of the guideline. This guideline has been annotated on the PharmGKB website. This includes a drop-down menu where a specific recommendation can be given for given combinations of alleles. This includes implications for the patient's response to venlafaxine, the appropriate recommendation for the specific metabolizer phenotype, and the strength of that recommendation. Remember that variation in other genes, in addition to demographic and clinical factors, including concomitant medications, can affect treatment. It remains the responsibility of the clinician to determine the best course of treatment for a patient. CPIC and PharmGKB assume no responsibility for any injury to persons or damage to persons or property arising out of or related to any use of CPIC's guideline or for any errors or omissions. The guideline itself and supplementary information are freely available at the PharmGKB and CPIC websites. You can access relevant pages using the links in the description below this video.